Our blood pressure, how often should we have it taken, and how quickly can it become too high?
Well, very good question, and I don't know if anyone has an exact formula for that, because it does vary from person to person, but everybody should start having their blood pressure checked probably in adolescence, even before puberty. And if most people will go into a clinic and have baby shots, have checkups, they may have a sports physical, a camp physical, and we almost, they all should have their blood pressure checked. But then when you get into your late teens, you should have it checked again. And people usually have had all their baby shots, done all those things, and frequently don't go to the doctor if they aren't sick. And many young people don't get sick, so they don't get their blood pressure checked. So they should get it checked in their middle and later teens. And then if it's normal, about every 2 to 3 years in your early to mid-20s, when you hit 30, probably every other year, and at age 40 and above, every year. Now, having said that, there's a little more to it than that. You know, Raina, we've talked in other segments about genetics. If your mom, your dad, 3 of your siblings, your grandparents, your aunts and uncles all have had high blood pressure, you should check yours more frequently. And I encourage people who have other risk factors, if they have high cholesterol, if they have a family history, as we discussed, if they have family members who've had heart disease and stroke, if they're overweight, if they're inactive, they should literally buy a blood pressure cuff. They can get them at health food stores, at pharmacies, most department stores. They have newer ones now that are digital, and you can push a button, it'll inflate itself and get it on. And then you can check your blood pressure yourself, and especially if you're at high risk, you should do that. And I encourage people who are at high risk to have a blood pressure cuff and monitor it every 3 to 4 months at home, take it. And your blood pressure, we used to say, should be on the top. The blood pressure is kind of interesting. The top number is the pressure in the artery when the heart is maximally contracted, pushing the blood through our arterial system. The bottom number is the pressure in the artery when the heart is relaxed and not beating and refilling. So the top number is called the systolic blood pressure, is when the heart is contracted and what we call systole. And the bottom number is called the diastolic blood pressure, which is the blood pressure in the artery when the heart is relaxed. The normals are based on arteries at the elbow. There are many blood pressure cuffs sold to test you at the wrist and at the finger, and studies have shown that we tend to have higher blood pressures here. So I think it's important that people get a blood pressure cuff that's going to check them at their elbow. And generally speaking, it should be for adults that the top number at the highest is in the mid-130s, preferably in the 120s, and the bottom number in the low 80s, preferably in the 60s or 70s. If you're in that neighborhood, you're okay. If it's higher than that consistently, you better go in and check it out.
So we could save ourselves a stroke, right?
We could save ourselves a stroke, a heart attack, disability, a lot of problems. A lot of problems.
Thank you, Dr. Thompson.
Thank you, Ray.